Welcome to our HSE Talking Health and Wellbeing podcast. My name is Noreen Turley, and today we're joined by Dr. Colin O'Driscoll, Clinical Lead for the HSE Integrated Alcohol Service in the Midwest. We're also joined by Eleanor Keogh, who's a project worker with the Integrated Alcohol Service. Thank you for joining us, and you're very welcome. Thanks for making the time.
Thanks very much.
Thank you.
So when I was preparing for the podcast, Colin, I was looking at the figures, and 2.9 million adults in Ireland drink alcohol. And we know that we've got an alcohol culture, as we say. But 51% of people who drink alcohol drink harmfully. And the other thing that scared me was 3 to 4 people die each day from alcohol-related diseases. And I just thought at the outset, maybe that is set the scene with what's happening in Ireland today. And then maybe we can go into talk about the integrated alcohol service that you have that hopefully is helping with this. But what's kind of your response? You know this, it's your business.
Yeah, we have a very unhealthy relationship with alcohol in Ireland and have had for some time. We seem to be quite aware of issues related to alcoholism and alcohol dependence. We're acutely aware of that very few people are untouched by that, or very few families are untouched in some shape or form. But what we're blissfully unaware of is the health consequences associated with drinking alcohol. It's so connected to various diseases, various cancers, urological disease, and so on. And there are direct links there which inform a lot of those figures that you were talking about. And we're very uninformed in that regard. Alcohol is a group 1 carcinogenic, which falls in the same category as tobacco, asbestos. Yeah, I think in general we're not familiar with that data. We're not familiar with those health consequences associated with drinking, which is such a normal part of our society.
Yeah, I think you're absolutely right there. And your service, the Integrated Alcohol Service in the Midwest, was set up in November 2022, and this was set up and is funded by Sláinte Care Health Communities. Is that right? So maybe will you give me a little bit of the background of why it was set up and maybe what the aims and objectives of the service is?
Department of Health was aware of the issue of alcohol and possibly the lack of treatment resources available for alcohol. So the idea was to set up a dedicated service that was going to integrate into the matrix of HSE and funded services that we already have, but that the task would be to specifically address our relationship with alcohol, to address the level of alcohol consumption in Ireland. Ireland is we're 9th highest in the world in terms of our consumption of alcohol, 8th highest in terms of binge drinking. So those figures really point towards we need specific services to address this in the community. We have residential tier 4 services, but we needed to address this in community where within a service that can connect to the various other services that.
So that's the integration.
That's the integration exactly of within the services.
So that's when you say integrated. That's the integration. You're working with all of these different community agencies to try and bring the service to the people who need it, I guess, is it?
Exactly, to address the alcohol issue in our society, but to work with people in collaboration with the other services that they will be engaged in. So, for example, we would commonly work with GPs, probation services, mental health services, primary care services, hospital services, so the various other services that the client is engaged in. That it's a joined up way of working, and that you create a no wrong door type approach. So whatever door the individual knocks on, if that's not the right service for them or not the only service for them, we can tap into the other services also and create referral links between services.
Okay, and who refers on to your service?
So the most common referral source for our service is the individual themselves. And
so people just come forward to you, and you're in the community, so they know where you are, they've heard about you.
We're in the community, so they know about us. It's probably testament to a lot of the work that Eleanor has done in setting up the service and creating that network and creating awareness within the community and within those specific agencies about our presence. People they call the phone number. Somebody will contact Eleanor with the details of somebody who's looking for treatment. And they call directly. So that would be the most prominent referral source, followed by GPs.
And Eleanor, just how did you, when Colin referenced you for setting up the service there, how did you do that? How did you make it so freely available or make people aware of the service when it's only been established since 2022?
November,
Yeah.
I suppose my own past work experience working in drug and alcohol services, I would have the links made with other services. I'm very familiar with other services. So again, it wasn't that easy to connect with other services as part of the integrated alcohol service. So that was how it kind of came off the ground. And again, with the support of our manager and our clinical lead, Colin, as well.
But you had a network there by the signs of it. You had a network there of knowing the people, the right people in the right organisations that you could contact so that they'd know you were there.
Yeah. I suppose I knock on a door and I don't stop knocking until you open it for the right reasons.
Oh,
so I have that tendency to do them things.
Yeah.
And again, on behalf of the individual and on behalf of the service, for people, some people are not familiar with the service. I suppose going back to when we first started, when people started ringing us, it was, wow, it's for alcohol, because they wouldn't engage with the drug and alcohol service because of the label. But definitely to know that it's for alcohol, people are more willing to come forward because it's alcohol, is their issue.
Okay. And, so would they be more embarrassed to go to look for, or why would they not? The
stigma attached with the drug and alcohol, the stigma to that, and that prevented some of our people in the community of engaging with services.
Yeah. And what kind of people show up to the service?
Every type of person.
Right.
From the age of 22, I think, would be our starting point, up to the age of 70, 76. So again, a very mixed range group. Again, a lot in their 40s as well would come through. So that's your kind of middle-aged ground at the moment. Yeah.
So what's kind of, if you can tell me the story of the service. So somebody phones you up, they say they're obviously, they're hugely in crisis, I'd say, are they, or just feeling really bad and for whatever reason, maybe like people would say hit rock bottom or whatever. It's awful even to think about, really. It's awful, it must be awful for them. But like, what happens next?
So I suppose for somebody to connect with the service, they just need to ring us directly. Our clerical officer would take their details and then it would be passed on to myself. And then I would connect with them by calling them. And again, that initial phone call from me is very important to see where they're at. Maybe they might be suitable to do the screening over the phone, or if it's not, it might be better that we do a home visit. You know, it depends on the individual, and you get a sense of that over the phone, and that's the key to that screening process for them. If they're happy to go ahead with the screening, I can do it to tailor their needs. And again, about 20 minutes, half an hour. And again, that can be a bit longer if they're in a crisis, you know. And we take it from there then. When that's completed, then we take it to our clinical meeting, which we have a clinical meeting with our clinical lead, Colin, every week. And cases are discussed individually and what's the best approach for them. Some might tell us they want residential treatment. Some might say they need counselling, or some might be for project working for myself.
Okay. So once you do that assessment, then does it become clear to you then the type of services they would need, or the type of support that they would need?
Yes. And again, that then comes back to clinical lead for a team discussion. It's never individualised. It's team discussion.
Yeah. And Colin, with the integrated service, you bring the service to the person, like Eleanor said there, she goes and visits, and she has a home visit, or you could meet them if they were in hospital. So that's really, that just shows the personal side to the service.
Yeah, the ethos of the service is that it's a non-judgmental, person-centered approach. So the concept is meeting people where they're at. And that's true both literally as well as notionally. So you know, if it makes sense to see somebody in their own home, sometimes it's a good opportunity, particularly if somebody is more elderly, to just do an assessment of the house and the home situation as well. And to do an assessment of risk, and we can bring in, you know, referrals to occupational therapists, or we can have our nurse perhaps get involved as well if there are health needs around that. So sometimes the home will tell you a little bit more as well.
Yeah.
So there's good rationale for engaging with somebody in their own environment. But otherwise, we will reserve rooms around the CHO3 region, in primary care centres and so on. to set up assessments, to set up counselling sessions, and so on.
Yeah. So your team is made up of how many? Numbers are always a funny thing to talk about, I suppose, in the health service. But like, you said nursing, is that specifically for the integrated alcohol service?
Yeah, we have a clinical nurse manager. No, not an occupational therapist within our service. So we have a clinical nurse manager. We have our project worker. We have 3 counsellors. And we have our clerical officer, and then clinical lead and operational lead.
Okay, but then if you did need occupational therapy or physiotherapy, whatever, you could refer to different community services within. So that's really good. So you're making connection with all those services that are available.
Yeah.
And you're probably so aware of all the services that are in the community. And Eleanor obviously knows a lot of people in the community because she's the one who got through the network of all the different people that should be contacted, which is fantastic, you know. I was just wondering, when you said, Eleanor, that you have anybody can show up to the service and all different types of people, is there, I'm not saying an average person, but what type of situation would somebody be in when they show up to your service? Or can you give me some examples of maybe success stories? I suppose they're the type of stories that we'd love to hear, you know.
And again, we also have the other stories too. Do you know that?
Yeah.
You know, where do they start when they're at the bottom? You know, and then how do you get them up a little bit? But the most important thing is that make that contact count is very important to everybody.
Yeah.
You know, and I suppose my own experience, I've dealt with people in low threshold, you know, self-employed, doctors, nurses, solicitors. You know, we've had a floodload of people come through the gates of our service for many a reason. You know, I suppose first, my own experience with one guy would be that a family member would have made contact with our colleague. She gave her my details and asked him to contact me. She spoke to me, gave me an outline of what was happening, so I had an insight to just helping him along in the conversation. And then he contacted me. And making every contact count was 110% there because I invited him into our service. Even though, you know, yes, drink was a small bit of issue, but there was something else. So I still invited him in and he was very open to that, which was the key. And then when I engaged with him after that, then it was an introduction to the clinical nurse specialist that we have available under social inclusion. And the engagement has been outstanding.
Yeah, that's
and
really
the outcome is really positive for that gentleman.
That's really good. And Colin, when somebody comes into your service and say if they need like a withdrawal, I don't have all the right terminology for this now, so you'll have to help me. But if they are really have a high threshold for alcohol and they need some help with withdrawal, can you offer that as well?
That would be via the GP. So what we would do is we'd work on, if it's in the community, we'd work in partnership with the GP. So the GP would prescribe a Librium detox, which we managed in the community. And we would continue to support the client ourselves and link in with the GP in the management of that. But if it's a residential requirement for a detoxification, then we would refer into the residential detox as well. And, you know, again, what you would have is make sure that the working relationship is set up and established, and also that you would work with the person afterwards. But generally speaking, if somebody goes for residential detox, they'll go in for residential treatment following that. And again, what we would do is we would look to catch the person on the far side of that residential treatment. So the care plan includes the pre-treatment piece of work, the treatment itself, and connection during that time, and then the post-residential treatment period as well. And
so what about the family? What about the other people in their lives? Do you do any work with them?
We would have an opportunity, if anybody has referred in and they're concerned, we would offer them support as a concerned other. And again, we accommodate that then and let them know that it's there for them.
Okay, you know? And when you say support, then what kind of support would you be offering them?
So it would be counselling as well.
And how to deal with the person who has the alcohol issue.
Some people would not be familiar with other services available to them. Do you know, the likes of NE and things like that, support groups for concerned others that's dealing with that. So we could open the window of opportunity there for them as well.
Yeah. And the thing that always that every time we do and talk about any of the services that we have, we talk about early intervention and the importance of early intervention. How would somebody notice that they're developing an alcohol problem? if somebody was listening now and they're kind of a little bit concerned, they're thinking, oh, I'm not really sure. Should I get some help? Oh, sure, I'm grand. I only drink on such and such. Well, what signs in themselves would they notice?
Well, not being able to stop is one of the kind of key signs, and when somebody makes a decision themselves to make a change to their drinking pattern of behaviour, if they can't follow through with that, or they find that they had a clear goal to do something and it failed and it didn't work, and they're kind of back to the old pattern of behaviour. So that's kind of indicative of there's some loss of control here. So the alcohol using behavior isn't adhering to what the decision making of the user is, if you like. But also to say, Noreen, the integrated alcohol service is not just for the kind of inverted commas dependent drinker or alcohol use disorders, as we refer to it. This is for anybody who has any concerns about their alcohol use. So even if somebody considers themselves to be a kind of middle range drinker, not necessarily sticking out in their community, or not necessarily vastly dissimilar to other people that they're drinking with or living with, if they have a concern and they're not comfortable with their level of drinking and they want to reduce it, but they're just struggling to do that on their own, that's who we're for also, because that's a big portion of the community.
I would have thought it was somebody who was in serious crisis and somebody who had a severe addiction problem. So it's anybody that just has a concern. Now, obviously, we have Ask About Alcohol as well, and we've got Drink Calculator on there, and people can assess it. So, the listeners, they could go to askabout-alcohol.ie as well. But I didn't realise that now, Colin.
Often people will ask, is my alcohol use a concern? And I think the answer is another question. Well, are you concerned about your alcohol use? And if they are, then it's a concern, because it's a concern for them. And if they ideally would like to make a change to that, but just don't feel they can do that on their own, absolutely, this is a good outcome for them.
That's great to know, Colin, that it's not just people who are in crisis. Do you deal with any of the colleges in the local area? Do you work with them at all?
Yes.
You do, Eleanor?
Yeah, some of them would have been referred from the student council to our service, and we would deal with them on a counselling basis, and they would have been out for counselling.
Very good. So students can access, as long as you're over 18, you can access this service. Yeah. And I know this service integrated alcohol programme isn't available in every community around the country, but there are a few areas, Colin, aren't they?
Yeah, there are 4 pilot sites who are in their second year now. So there's North Dublin, Galway, Cork, and CHO3, which is Limerick, North Tipperary, and Clare, which is our own service. So they've been running into their second year now. I think ideally it would be great to see an expansion to that.
Yeah.
But if there was any evidence of the need for integrated alcohol services from the moment we opened our doors, we just had an absolute flurry of people. Almost felt like they were waiting on the sidelines for something to open up that was relevant to them, for them to come and address their concerns around their alcohol use.
Was there nothing before this? Was there no...
There is the HSE Drug and Alcohol Service.
Okay.
Yeah. So the Drug and Alcohol Service is if the individual is over 26 with an alcohol-only issue, they sit outside of the criteria.
Okay.
So there was a gap there. But there are other services. So we do have funded services in the region. We have Saoirse is an addiction treatment service for alcohol. We have CSMT. We have Limerick Youth Service. Anna Liffey. Novus have a respite service. There's North Star Family Project are set up to work with families. So all of these will have some involvement with people struggling with alcohol use. But this is the first very specific statutory service for with an exclusive focus on alcohol.
Yes, and there's 4 in the country. So I think that there's going to be an assessment or an evaluation of the integrated alcohol service, and hopefully that they will be expanding the service then.
It would make sense.
Another time. It would make sense, especially given our culture and our history with alcohol, I suppose. And so do you do education in the communities or anything, Eleanor? Do you go into community groups and talk about alcohol or anything like that? Or maybe that's not your role, is it?
Yeah, well, I would have represented the integrated alcohol service in a couple of events. Yeah. Brought the attention to the service, because some people are not familiar with it. And I suppose only 2 weeks ago I would have went to the intellectual disability service in Ennis, just to give it a chat around alcohol, build the awareness within that group there, that the staff had worries about 1 or 2 gentlemen maybe that have issues with alcohol. So it was just to bring it to the forefront, to know that there's a service there for them as well.
Yeah.
Eleanor will go anywhere she's invited.
Well, I bet she will. Yeah, and obviously she makes such an impact no matter where she goes. So it's fantastic.
That's for sure.
Yeah.
I suppose just to go back to the drinking part there, I suppose if somebody rings and they're only 28 and 30, their goal is just to reduce, take control of their drinking. That would be their goal, not sobriety, because they're quite young, and as you're well aware, it's part of their culture. So for people in that age group, they're normally just learning how to manage their drinking, control their drinking, and maybe get an insight to why they drink to that excess. But it's not to stop drinking.
Okay. Yeah. And then I guess if there's other, like you said, if somebody did have mental health issues or whatever, you can refer on, or you can refer through the GP as well. So you look at the whole person, like Eleanor said already, making every contact count. So you look at everything that's going on with the person, I'm sure.
Absolutely. And that's not refer on and say goodbye. That's refer on and stay involved and continue to work with the person.
And how long
alongside
would somebody
of the service.
usually be in your service?
It's really different. It's really unique from person to person. So it could be anything from a brief intervention to from the start of our service. So we opened in November 2022. We will have certain clients who are still working with us. Sometimes they step down from the weekly to the 2 weekly to the monthly. But there's no time limit. So we work with everybody. It's an individualized, tailored care plan based on what their needs are. And those needs, of course, are changing and emerging all the time. So it's constantly reevaluating and responding to whatever that need is. So there isn't a limit.
And did they grow a dependency on you guys then?
They would find safety.
Yeah.
Safety and support. That would be the key, to know that they can pick up the phone.
Yeah.
And the wraparound service. Because I suppose my own experience with one gentleman is that when I met him for the very first time, he said to me, "I don't trust you." So, so again, that fear. So you have to keep that support and be very wraparound to their needs at that time. Do you know what I mean? It's very important. So his needs were very complex at the time. Again, trust was a big thing for him, and I had to allow him that time.
Yeah.
And that was the important piece that I understood from him, that he didn't trust me. So I had to earn my trust. And I have.
That's fantastic. And do you have any figures of people who actually call your service and look for your service and continue on, or people who fall off and don't continue on and don't go through the service?
Yeah, so I mean, again, there's a great variety, and sometimes it's not right for somebody. It might not be the right time. It might not be the right service. It might not be the right intervention that's required. So I suppose a big part of that screening assessment is that we get to meet the client, but they get to meet us, and they get to get a sense of, well, what is it that you offer? And I think the vast majority will continue through with our service or with whatever referral pathway we develop as part of that collaborative assessment. But that engagement is really key to figure out what is this, and is this for me? And sometimes I think people are dipping their toe in the water a little bit. Maybe not quite ready to make a shift, make a change, or commit to a process. And they're sounding out, well, is there a safety net there for me? Because I might be there soon. And of course, the engagement process is part of moving them in that direction. But I think sometimes it's enough for them to know, and we'd have lots of people who would come back to us having had an interaction with us maybe 6 months previous.
Yeah, so they might have just been ready, but they know you're
Not
there
quite ready.
and you are. And
maybe they were
turn them away
encouraged by somebody else to go there, so they're just testing the water. Yeah,
I like the way you say encouraged. I'd say that it would be something that you could imagine would need encouragement at times. Where do you see the service going in the future, Colin? Or where would you like to see? Well, what's your aspirations? What would you?
I'd like to see it expand. I know we talk about kind of expansion and rolling out into other regions, but even within our own region, we have huge demand for our services. We have an active client load between 90 and 120 at any given moment. So it's very, very significant. So again, it's a massive endorsement of having the integrated alcohol service in the first instance. But I would love to see it expand, that we could greater cater. There are other areas that we could look at developing the service.
Geographical areas?
No, sorry, other areas, for example, within the hospital network, within primary care centres, within probation, setting up tailored services for people who might be referred to probation, within homeless services and so on. So we could have very kind of tailored interventions based on different sectors. And so, I would love to see it expand. There are certain things that we're going to do. We're looking at doing a controlled drinking group. So working with people who are seeking to it's called moderation management, but they're trying to moderate their drinking rather than stopping. There's excellent evidence for doing that, and it's been around for quite a while, but you don't tend to find that in treatment services, regardless of the evidence that's there.
You assume that it's just sobriety, don't you, really?
Absolutely.
Yeah.
And I think that's a key message about a service like ours. It is non-judgmental. It is working with, as Eleanor said, whatever your goal might be, that's what we're here to help you for. It's not for us to make the judgment you need to do X, Y, and Z.
Yeah.
It doesn't work like that, and the evidence doesn't support that. So our goal is to work consistently with the evidence around what's effective to help people to address their drinking. And actually, what we find, or what the evidence shows, is that more people achieve sobriety by trying to control their drinking than do by trying to abstain from their drinking in certain research trials. So it's a very interesting dynamic that, that the sense of the control and the decision being left in your own hands is a really important one. And you tend to make better decisions when that sense is there and is facilitated within a treatment intervention.
Yeah. Yeah, that's really interesting now. I didn't actually realise that at all, And supposing if somebody's listening to our podcast today and they're thinking, okay, we said ask about alcohol, but if they're in your local area, I guess, or even around the country, where should they go to get some support and some assistance?
Again, I suppose we are familiar with a lot of GPs within the community, and we have our flyers around. Our GPs are getting very familiar with the service. So again, wants to go to their GP and say that they have an issue with alcohol, they can refer them straight on, or they can take our contact details from the billboard in the doctor surgeries as well. And again, I suppose just to bring it back to the core of the issues with alcohol is our first client rang us from a bar stool. He was our very first client of our service, and he rang us while he was sitting in the early morning pub.
The early house.
The early house, and that was he was our first call, and he has done really well.
Oh, it's fantastic. We should have got him, but it's people, it's the stories like that we need to be telling people that it is possible.
Yeah.
And you start from there, from
wherever
the bar
they
stool,
are. Yeah.
wherever they are. And then that's a great success story,
Yeah.
That's
and
fantastic.
That was the key point for him, was that door was opened where he was at, which he was amazed when he got sober, and things went to the better side for him.
And just to hear the stories about the people and how their lives have changed.
Oh, dramatically,
It must be like night and day for them,
Yeah, and I suppose their awareness around the health and the well-being and what's open to them. We've a lot of people that are in the hostels and are homeless. They have engaged in training, and they're receiving manual handling courses through our service as well, with the links that we have, and getting safe pass and getting some of them back into work. They can do it.
Yeah.
And because they're addressing their alcohol, they have something to look forward to as well. So that's part of their care plan. And again, the motivation is within oneself when they come to the door. But again, we can just open that door a little bit more for them.
Mm. Oh God, Eleanor, I could do with talking to you for another while. I can understand why you've had so much success in your area, you know, and what you're doing. So I guess what we want to say to people then really is to make that call. If you do need assistance, call the Drug and Alcohol Helpline. You'll find information on hse.ie. Or do you have a local number that people can call if they're in your area? In your area, do you want to give it there, Colin or Eleanor?
061 492 016.
Okay. And just, I suppose, is there anything else before we finish that you'd like to say, or you'd like to finish on, Eleanor, like your aspirations or your dreams for the service going forward?
Again, just pick up that phone, make that one call, and it can be just the start of something. Again, just to remind people that there is people that are frightened of making the call, and they have made the call, and they're in a good place, and they're really, on the other side of what they never could have achieved if they hadn't made that call. And some people have only come to the service and have never engaged with any services.
Yeah.
Never have any links with any of the services, only their GP. And they have picked up the phone. So again, it is open to everybody. It doesn't matter what your needs are. If you have an issue, just pick us up. And if we can't do something, we will be able to signpost you for sure.
So after Eleanor just has given that message, Colin, was there anything else that you wanted to say to our listeners?
Just to outline that the service is a non-judgmental service. This is a free service. It's confidential service. We don't share information with any other agency other than as is consented by the client themselves or as per their wishes. So yeah, it's a safe space for them to begin to explore. If I were to make a change, what might that look like?
Yeah.
So just take the first step and make the call.
Thanks a million, Colin, for that. And just like to say to our listeners that if you liked what you heard today, or you think anybody would like to listen to this podcast, to please share it with your friends, colleagues, family. And thank you very much. That's another episode of HSE Talking Health and Wellbeing.